Good morning everyone, my name is Bibi Sarai and today I'm going to introduce early intervention strategies for children with autism spectrum disorder, where I will be talking about the professional teams that supports autistic child along with 3 practical teaching resources or tools and 3 suggestions for general classroom teachers. And next I will be discussing about Luke's case and how to collaborate or communicate with his parents. So first off, what is early intervention strategies? Early intervention strategies are specialized support for children with developmental delays or disabilities, aiming to improve their communication, social skills, and also learning outcomes. Children with autism spectrum disorder benefit from professional teams which include developmental pediatrician who diagnose autism and also check for other health problems, a speech therapist who helps a child from using gestures, pictures to using words and understanding social cues and body language, an occupational therapist who focuses in everyday skills like feeding up, dressing, and helps with sensory issues through sensory integration therapy. And there is a behavioral therapist who implement evidence-based strategies like applied behavior analysis to manage challenging behaviors and to teach social emotional skills. And there is a social worker who supports the family with accessing services or community resources and also coordinates between school, home, and medical providers. Coming to 3 teaching tools, we have the first one is visual schedule board, which is a board with a picture card showing the daily routines or transitions. For example, there is a washing hand picture, and then there is a snack picture, and then there is a picture where the children are playing. This shows the children and helps them know what is going to happen in the sequence or what is going to happen next. This really helps them feel less anxious because they knows what comes next. And the second one is visual timer, which shows the time is disappearing. It shows a color when the time is disappearing. It is very useful in reducing anxiety and managing transitions. And the third one is calming tools like noise cancellation headphones or fidget toys like fidget spinners that really helps an autistic child to calm down or maintain focus in a very busy classroom. And the 3 tips for classroom teachers, the first one is using first, then language. For example, instead of saying, "Would you please help me to put the books away and we can have the snacks?" Instead of this, the teacher can use first, books away, then snacks. And the second tip is creating a calm corner with soft cushions and fidget toys so that the child can go anytime there whenever he is feeling too stressed or overwhelmed. And the third one is giving warnings before transitions. For example, saying in 5 minutes we are cleaning up and showing a visual timer instead of saying just tidy up, which scares them and can also trigger anxiety. Coming on to how I would collaborate and communicate with Luke's parents is first I would listen carefully to them and thank Christine for sharing her worries. I would say something like, "As a parent, you know Luke best. Can you help me understand him?" And I would ask questions like, "Can you show me his important signs?" Or, "Can you tell me what makes him sad or happy?" And I would also ask her about his likes and dislikes and write it down in a paper. Then I would say something like, "I know how you are feeling now. I will make sure to send you everyday notes so that you are aware of what we are working on. Or even if you pick up Luke, then we can have a short, quick talk." When working with Luke's parents, I would follow ethical rules such as respect parents as experts. So I would not solely prepare a goal or a plan for Luke, but I would also include his parents to make the goals with me together. And the second one is keeping confidentiality. I will never share Luke's behavior to gossip around my colleagues or even the parents of other children. And the third one is get informed consent. So before I try any new strategies to look, first I would explain it to Christine that how it works and what it is, and Christine must agree first. And the fourth one is never blame. I can never say you should have taught this. Instead, I would say, let's work on this together on what we can do. And the fifth one is being honest about my skills and sharing exactly what I can do and what I cannot do. Thank you.